This is a contrast and CT scan of a 37 years old female patient. She has got a cystic swelling along right side of neck for the last 12 years. It is painless, it is gradually enlarging and it is fixed. Mucosal thickenings are noted in some of the paranasal sinuses, suggestive of sinusitis. Now, as I scroll it down, there is an oblong cystic lesion which lies along the right lateral side of neck. This one is the cystic lesion here. It lies posterior to the sternocleidomastoid muscle. This is right sternocleidomastoid muscle which is displaced anteriorly with fairly distinct interface. Now posteriorly it lies in contact with the anteromedial surface of right levator scapulae muscle which is displaced posteromedially. Inferiorly, this cystic lesion extends up to the right supraclavicular fossa. Few internal separations are present. No solid component is seen inside it or along its walls. In its upper part, medially, it extends into the right parapharyngeal spaces at the levels of oropharynx, hypopharynx, and larynx. This cystic mass lesion has displaced right internal carotid artery and internal jugular vein medially with distinct interfaces. Laterally, it has well-defined borders. There is no involvement of the subcutaneous tissues or overlying skin. This is a case of lymphangioma. The second branchial cleft cyst, it lies anterior or anteromedial to the sternocleidomastoid muscle. Very rarely, third branchial cleft cyst may present posterior to the sternocleidomastoid muscle, but it is very, very rare. The commonest of the branchial cleft cyst is the second branchial cleft cyst. Coronal scan, same findings. Please observe the oblong nature of the lymphangioma displacing adjacent muscles and the carotid sheath. This is the sagittal scan. This is right sternocleidomastoid muscle which is stretched along the anterior surface of the lymphangioma. This is the levator scapulae muscle posteriorly. There is no involvement of any of the muscles. These findings are very typical of the lymphangiomas. Internal carotid artery and internal jugular vein are displaced medially.